Thank you. Yes, global health is a concern for the health of all the people, the research into health matters that affect all people, and a focus on making health care available equally to all people. Director Kickbush of the Global Health Program defines it as health issues that transcend national boundaries and governments and a call for actions on the global forces that determine the health of the people. Global health is important to pay attention to because ethically all people should have access to quality health care. As people travel and companies expand around the world, the health of all people comes into play. Infectious diseases will cross borders, and unhealthy countries are no help to global economies. Reporting global health issues has resulted in numerous accomplishments for the world. Countries have allotted more dollars to medicines and vaccinations. People receiving medicines for AIDS treatment, for example, rose from 200,000 in 2002 to 7 million in 2011. Countries involved in global health reporting have seen a 50% decrease in malaria. Simply put, knowing what is going on around the world helps the world prepare for what lies ahead. Okay, communicable diseases are also known as infectious diseases. These are caused by bacteria, viruses, parasites, or fungi. They are spread from person to person or animal to person through contact with blood, feces, or bodily fluids. Communicable diseases include tuberculosis, HIV/AIDS, hepatitis, and measles, as well as rabies and malaria. Non-communicable diseases are chronic diseases. These are caused by genetics, environmental, psychological, or behavioral factors. The majority of deaths annually are due to these chronic diseases, such as cardiovascular disease, cancers, chronic respiratory diseases, and diabetes. Common causes of these include poor diets, low physical fitness, and tobacco and alcohol use. Ebola is a communicable disease that can affect humans and primates. It is caused by a deadly virus that originated in Africa and was first discovered in 1976. Ebola is an animal-borne virus that is spread through direct contact with blood or bodily fluids such as saliva, urine, or semen, or from infected objects like needles and infected bats or primates. Any type of exposure to the virus would raise someone's risk of contracting it. Healthcare providers are at the greatest risk. Other risk factors would include using contaminated items such as needles or even clothes or bedding, or contact with infected animals or unprotected sex. Well, there's no vaccine for the Ebola virus yet, so if you travel to areas where there has been an outbreak, make sure you wash your hands often. Hand washing is the #1 prevention tool for all communicable diseases. Avoid contact with bodily fluids or objects that might have come in contact with these fluids. Stay away from bats and primates and avoid Ebola treatment facilities. And if you're caring for someone infected with an Ebola, make sure to wear protective gear like gloves and face shields and sterilize all the items that you use. During the Ebola outbreak, as well as any new health issues, rumors of the disease spread quickly. And because fear drives people into fast action, these rumors are believed by millions. Some rumors were, you could contact the virus just by flying in a plane, or that hospitals in the United States can't handle the virus, or that it could be spread by mosquitoes or in drinking water. Rumors scare people and create feelings of apathy towards those infected. False fears are very dangerous to people's daily life activities. Think of going to work, school, or even the grocery store with these fears embedded in your thought process. The results can be devastating and cause panic. Rumors on the other side of the spectrum were dangerous as well. The Ministry of Health of Guinea set up a hotline to answer questions. Many of these questions were about prevention rumors. Can eating raw onions prevent Ebola? Will drinking condensed milk prevent Ebola? Having correct information helps to protect people and allow them to make more rational decisions. Yes, Ms. Hickox was in Sierra Leone helping to treat patients with Ebola. When she returned to the United States, she was held in a quarantine tent for 3 days. And when she returned to Maine, the governor there wanted to quarantine her for another 3 weeks. She defied those orders, and a judge ruled partially in her favor, saying that she could come and go as long as she pleased, as long as she submitted to symptom monitoring. In cases like this, the government must walk a very fine line. There must be balance between protecting one's personal rights and the safety and health of the community as a whole. The people of the United States have a right to many freedoms, of speech, of movement, and of the pursuit of happiness. Ms. Hickox has the right to travel to aid the sick and the right to return home without harassment. However, with the increased public fears pertaining to deadly diseases, care must be used to ensure that travelers such as Ms. Hickox are not contagious to others in the community. It is also important to offer both sides protection from some that may have reached a panic mode. It is impossible to protect 100% of everyone's rights in this case, and the government must find a way to balance all of our rights. Smoking cigarettes harms nearly every organ in your body. It increases your chances of stroke, lung disease, diabetes, and COPD. It causes cancers in the lungs, bladder, cervix, colon, stomach, and mouth and throat. Even using smokeless tobacco products can cause cancers in the esophagus, mouth, throat, and pancreas. Smoking causes heart disease by raising triglycerides, making the blood thick and sticky, increasing plaque buildup, and narrowing blood vessels. Secondhand smoke is when an individual who does not smoke at all is exposed to the dangers of smoking by inhaling air that is tainted with smoke from the smokers around and from the cigarettes burning in their vicinity. Secondhand smoke exposure is responsible for more than 40,000 adult deaths and at least 400 infant deaths annually. Adults who are exposed to secondhand smoke can develop lung cancers, strokes, and coronary artery disease. Children are at an increased risk for sudden infant death syndrome, acute respiratory infections, and diseases of the middle ear and respiratory system. Nicotine is an extremely addictive drug. This is illustrated in the fact that it is widely known that smoking is dangerous to one's health. But of the 35 million people who want to quit smoking each year, 85% of them continue to smoke, many relapsing after only 1 week. Nicotine increases levels of dopamine, which regulates the feelings of pleasure in the brain. Inhaling cigarette smoke enables the nicotine to reach the brain at a peak level in only 10 seconds. These feelings of pleasure subside quickly, though, causing withdrawal symptoms, which makes the smoker want to smoke again. Withdrawal symptoms include irritability, depression, anxiety, sleep disturbances, and increased appetites. These symptoms typically decrease in a few weeks, but can last for months. Anyone looking for help in quitting smoking can call the National Cancer Institute's Smoking Quit line at 1-877-44-YOU-QUIT. That's 1-877-448-7848. Thank you.